Okay, the skill we're going to do now is a central line dressing change. This is a sterile technique. They're usually done 24 hours after insertion. If there's any bleeding under your dressing, you're going to do it at least every 48 hours. And then if there's no bleeding or gauze under your dressing, we do it once a week and PRN. So it's also a PRN, so always assess your dressings, and if they need changed prior to the due date, you are able to do it. So we have one that is intact, it looks good, and it is the weekly date to change our dressing. So that's what we're going to do today. So I have a central line change tray with Chlora Preps. It should have everything I need in here for my dressing change, except it doesn't have the bio patch. So this is a bio patch. I'm going to have to add it to my sterile field once I get it set up. And this little patch is impregnated with antimicrobials. And so when you put it around your central line insertion site, it helps reduce infection. That's why we change them every 7 days in PRN, and this helps reduce infection, which you've all heard of CLABSI, central line associated bloodstream infection. So this is the skill that is associated with that infection. And so as nurses caring for our patients, we are going to do our best to reduce infection. And one way we do that is we use our bio patches when we do dressing changes. When you do a dressing change, you also notice there's a stat lock, and that is changed with the dressing changes, which I have one here. I'm not going to change it today, but I'm going to just let you know that you would usually change that along with the rest of your dressing when you change it. Also, we change our cap, so at the end of your lumens, which it could be a single lumen, double lumen, triple lumen. This one is a triple lumen, it has 3 lumens. When you do your dressing changes at that time, you also change your Lorlock caps. You also want to change your caps if you draw blood from your central line, which it can be used for that. So after you draw blood, you would flush it and change caps. So you could also do it PRN, so always remember any skill can be done as needed to ensure the safety of your patient. One thing I'm just going to show you before I get started is another type of bio patch that you might see in practice. So the ones that we use, you will notice if you look in your nurse packs, it has a blue side and a white side. That's what we're going to use in our demonstration. And when you use the blue and white discs, you want the blue side up, which it will say that on there to remind you, but blue to the sky. Another patch that is common in practice, I'm just going to open this and show you, I'm not doing it in a sterile fashion, but it has a yellow and a gray side. And for this particular patch, you want sunny side up. So the yellow side goes up and the gray side is impregnated with your antimicrobials, and that goes towards your patient's skin. So you may see, those are the 2 most common patches we see today in practice. So to do this, I am going to have to take down this dressing around insertion site, set up my sterile field, and change the dressing. When you do this, you want to ensure that anybody who's going to be in close proximity to you and your patient while doing the dressing change wears a mask. So I'm going to need to wear a mask. My patient is going to need to wear a mask, and if there were any friends or family that wish to stay in the room, we would ask them to wear the mask. I usually ask them to step out of the room for a few minutes, so that just makes it easier. But if they don't want to step out, they want to be there present, or you're doing an instructional, because they're going to help do this at home, they need to wear a mask as well. So a mask comes in our kit, which I will have to open and apply to myself. I would have to get one from another location, my storeroom, to have it put on my patient. When I do the removal of the old dressing, I'm going to do it in a clean fashion, so I'm just going to wear clean gloves, and then I will take my clean gloves off, sanitize my hands, and put on my sterile gloves, which are also in my kit. I'm going to show you using gloves in the kit. So to get started, I'm going to pull back the top of my kit. So we've used kits many times in the lab. It opens in a similar fashion. Pull back and expose what's inside. and right on top is my mask. So I'm going to take my mask out and put it on me. Make sure my patient has the mask. And we have a sterile field open, so we need to keep that in our field of vision at all times. To remove the dressing, I'm going to put on clean gloves. And remove the old dressing. So it's a Tegaderm. So if you watch the IV start video there at the end of one, we removed that IV. So Tegaderm. Hold at insertion site and pull Tegaderm towards the insertion site. You don't want to rip out the IV with removing this. So that's why we're keeping it secure. You pull that off. It has a little bio patch under there. I need to remove. I might have to rip it. Doesn't want to come off. But I got it. Okay, so I removed all of that. Take off my dirty gloves, dispose, hand sanitize. Come back to my sterile field, and there's a pair of gloves in there, so I'm going to go on top and pull my gloves out. I'm going to use these. Before I touch anything else though, I need to add my bio patch that was not in my kit. I'm going to add it to my kit. So we've done this too. We've added things to our sterile field. So I'm going to open it, and then over top of it, dump it out and remove. Now I'm going to put on my sterile gloves. These are one size fits most, so you have to be quite delicate with them. But same way we've been putting on sterile gloves, I'm holding that by the cuff and just pulling it down. Now this one, I have to scoop it up by the cuff, so sterile to sterile, get it positioned, thumb out, hold it up high, and pull back away from my skin and get my hand in there. I've messed up, which you've all have demonstrated you can do this. Get it fixed. And there, don't need that. So come back to my sterile field. I have a towel in there, which we're used to using drapes. So I'm going to set up my towel so I can get everything organized. I'm going to drop it on my table. Got shiny side, non-shiny side. Drop it from a distance so I don't touch my table with my gloves. It has tape in here, so if I wanted to secure this, I didn't have a stat lock, I could secure it with tape because you don't want it to be pulled on. I have a ChloroPrep, so this is similar to the ones we used to clean our skin when we did IV starts. It's just a little bit different design, but you can hear the capsule in there. These are the things, the wings I'm going to press to break the capsule to make my sponge wet. I have a gauze square if I needed it. I have my bio patch. I have a new dressing. I have a cotton tipped applicator if I needed that to cleanse or to do something. It's there. And I have forceps. So the forceps are going to allow me to touch things without using my fingertips. So I'm going to get my ChloroPrep. I'm going to break the capsule by squeezing my wings.
Just so I can see.
And I'm going to take my tweezers and lift up my catheter, and I'm going to clean around insertion site. So, and in circular motions going outward. So just as we've learned in the past, you clean from center outward. So I'm cleaning outward in circles around. And then I take my ChloroPrep and I'm going to clean the catheter as well. So on all sides of the catheter to get it clean. We should scrub this for at least 30 seconds since we're cleaning skin. So I've cleaned, you'll see some people, they may hold up the catheter and they may go from side to side and down outward. Either way is really acceptable, but you want to make sure you get insertion site and then a larger area and clean your catheter. So we've cleaned everything. So these are dirty. We can dispose of them. If we needed our Q-tip or cotton applicator or our gauze, if there was any bleeding or drainage, we may need those things. If we had not had a stat lock, we may need tape, but we have all that, and ours doesn't have any drainage or bleeding. So now we have to wait for our ChloraPrep solution, chlorhexidine, to dry, which on a real person may take 1 to 2 minutes. This just depends. So we wait for that to dry. We pick up our bio patch. It's perforated, and so I want to put that around the insertion site. So I'm going to loop under there, and the perforated, pull it apart and put it up. So I need to touch my patient some to get that on there correctly. So it's not 100% sterile, but as we have done with other procedures, it's as clean as you can and you don't contaminate it unnecessarily. So I've applied my bio patch. Now I'm going to put a dressing on. So I take off the back, hold my dressing. So again, the middle of the insertion site should be central or middle of my dressing to get as much coverage as possible to protect it. So put my down and then get any air out. And then this should be just like we've had tegaderms before. You're going to go around the sides. Make sure it's laying flatly. I have a tag on here, so I would date, time, and initial, so people would know who changed it, when, and what time of the day. Put that on the side of my dressing so people can see it. And then if I did need to change the stat lock and the caps, I could do that at this time, but you want to make sure you uncover and cover insertion site first. So if I was done, I could remove my gloves, dispose of them, remove my mask, dispose of it, have my patient remove their mask, clean my hands, and we're done with the central line dressing change.
Dr. Pilon, what about those ones in the chest? Do you have to do any of those any different? They look more intimidating, like you'd have to do something different.
Not necessarily. Same procedure. It's a sterile technique. You're going to wear masks. You're going to undo the old dressing with clean gloves. And then you're going to set up your sterile field with your sterile gloves on, cleanse the area, and reapply your dressing. One thing, though, I like to mention, which you brought to my attention, just to do differently. When you are changing the stat lock, my advice is you remove the old one, and they have little clips that go together. When you're applying the new one, put your little spokes from your central line into your little clips and close your doors, and then remove the adhesives and apply it. I just say that because myself, I've done it the other way, where I've put the adhesive on my patient, put the little prongs in and close the door, and say it's on their neck or their chest and you have to press to get those doors closed. Sometimes you have to press a little hard to get that to happen, and they may be sensitive in that area, so it may be sore for them. So if you put your spokes in first, close your doors, and then adhere it to your patient, it's just more comfortable for them. If you did it the other way, you wouldn't be the first, it wouldn't be wrong, it's just a little more comfortable for your patient.